Hi, my name is Dr. Erick, and I am going to talk about abdominal wall defects. Abdominal wall defects are a type of congenital defect that allows the stomach, the intestines, or other organs to protrude through an unusual opening that forms on the abdomen.
The diagnosis of a fetal anomaly is devastating to a family. They go from the joy of being pregnant, the joy of having a baby, to my baby has a problem, my baby might not survive, where do I turn?
There are two main types of abdominal wall defects that result due to the change during development. They are omphalocele and gastroschisis.
We're told that my son had a congenital defect called an omphalocele.
It was a difficult diagnosis to accept.
They looked at all of our tests that we had done up to that point and basically told us that they thought that they could fix Charlie's problem.
Applications in medicine. Before birth, openings in the abdomen can usually be detected via detailed ultrasound or AFP screening. Concerns that arise due to abdominal wall defects can be threatening and require immediate and intensive medical care.
Trouble or is not at risk to die before birth. It's important to follow fetal growth because these fetuses, for whatever reason, tend to be small and may be due in part to loss of protein from the extruded bowel in the amniotic fluid.
At 32 weeks, we were coming in twice a week, and that's when it really kind of hit us that, at least hit me, that, it was getting closer and closer.
Pros. Abdominal wall defects, specifically the main two types, gastroschisis and omphalocele, are rare in occurrence.
The other things to follow with gastroschisis are the appearance of the bowel, because the bowel, due to the amniotic fluid exposure or due to constriction at the abdominal wall defect, can cause bowel damage.
And as the baby grows and that defect becomes more restrictive or constricting, it can actually interfere with blood flow out to the bowel, or it can interfere with blood flow back from the bowel.
Cons. If the abdominal cavity is too small or when the organs are too large or swollen to close the skin, it may be difficult to fit all the viscera into the small abdominal cavity.
And that can cause a piece of the intestine to die, leading to what's called intestinal atresia. So the consequences of a defect in the abdominal wall, if it's too small, can be fairly devastating.
Issue applied in Ecuador. Abdominal wall defects can be treated surgically if there is no accompanying abnormalities. The surgical procedure, also called omphalocele repair closure or gastroschisis repair closure, is not overly complicated.
So things can change quite rapidly, and it's important to have the team that can mobilize quickly, again, to get the best outcome for mother and baby.
For omphalocele, once the workup is done, including karyotyping, it's important to do serial sonographic surveillance, particularly following for fetal growth.
Thank you.